Hi, Tara, can you hear me?
Yes, that's much better. Thank you.
Okay, I've just signed in using my my phone, so hopefully this is better.
Okay, so far so good. Thank you.
Okay, we're good to go, Mr. Chair.
All right, thank you very much. Good morning, everyone. This is July 12th, 2022, and this is the Long-Term Care Committee of Management meeting. We'll call this meeting to order. Just remind members of the committee of their obligation to declare a pecuniary interest or an interest. Hearing and seeing nothing, if anything should arise, you may declare it at that time. Our first report today is LTCR CM 1122, the long-term care director update be received for information. Can I have a mover for that, please? And I'm not able to see people.
Okay, I see Councillor Burley and Burton Hicks, I believe.
All right, moved by Councillor Burley and seconded by Warden Hicks. And I believe Jennifer is on a well-deserved holiday this week, and I believe Dana and Renata are through this report.
Yes. So thank you, Mr. Chair.
Hi, Dana.
Good morning, everyone, and thank you, Mr. Chair. I'm going to review the first part of the director's report, starting with the COVID-19 update, and then we'll pass it on to Renata for the Fixing Long-Term Care Home update. Our homes continue to be using a cautious approach as we have throughout the pandemic, and have maintained our universal masking, screening, and daily rapid antigen testing, along with enhanced surveillance. In May, there were COVID directive updates from the ministry, specifically regarding the definition of fully vaccinated, which is proof of completing a primary vaccine series, and the definition of being up to date, which means an individual has received all recommended COVID vaccine doses, including any booster doses if they were eligible. Our Grey County long-term care COVID-19 immunization policy has been reflected with this updated language, the up-to-date vaccine language. On June 10th, the Chief Medical Officer of Health, Dr. Karen Moore, issued a memo regarding the revocation of Directives 1, 2.1, 3, 4, and number 5. And with this removal of the directives, we were provided with guidance to support our sector. This included a new guidance document on personal protective equipment for the care of anyone with suspect or confirmed COVID, along with COVID response measures for long-term care and guidance for long-term care and retirement homes with for public health units, so providing public health units with the direction to support us. And these resources are hyperlinked in your report. In terms of COVID-19 outbreaks, during the timing of this report, we had 2 at Lee Manor. One was declared on 3 North from May 14th to June 4th. It impacted 15 residents and 9 staff. And not surprisingly, the Omicron variant was identified, which is highly transmissible. The other outbreak at Lee Manor was between May 29th to June 9th, and that was on 3rd South, with 6 residents impacted and no staff. During the outbreaks, we worked with public health reviewing case surveillance and our IPAC measures to ensure we had best practices in place, while also making sure our residents' well-being was a priority. And moving on to vaccinations, as you can see by the chart in your report, our vaccination rates continue to be maintained at a high level for residents. And as new residents move in, we identify when they're eligible for their booster dose, and we are able to administer on site. The same for our staff. Along with vaccines, active screening and surveillance testing is another measure we are putting in place to keep our care community safe. Daily rapid antigen testing continues for all staff, students, support workers, volunteers, designated care partners, and the general visitors who come in. And this helps us to test before visits, as well as to identify early detection. On average, our 3 homes are completing over 2,000 rapid antigen tests on a weekly basis. And to support our active screening process, we worked with IT, and our electronic screening tool was updated to identify individuals that are not eligible for rapid antigen testing due to a recent COVID infection. The tool helps us by indicating the date that they were infected, which then auto-populates that 90-day exemption. So we're not testing anyone who shouldn't be tested. So in that essence, not getting any false positives. With respect to visitors, a virtual family meeting was held May 25th to provide an update related to the Fixing Long-Term Care Home Act. And Grey County's updated visitor policy was also discussed, along with the introduction of the new risk assessment tool to help us support working with unvaccinated visitors to do it in the safest way possible. All 3 homes continue to offer visiting options through our Color It Connect program. We still have virtual visits, window, indoor and outdoor visiting, and they're being used on a regular basis, along as many of our residents are out and about in the community. And as you might hear more somewhere, even in a parade. So in terms of our staffing, each home continues to onboard new staff, and we're pleased to see returning summer students. Recruitment has taken place for 2 new resident care coordinators for leadership positions at Grey Gables and Lee Manor. And to support staff, students and volunteers, the administration of tuberculosis screening and skin testing will take place on site. So this initiative will support us with the onboarding process, as well as reduce barriers for our staff in obtaining this required testing, which has been a challenge throughout this pandemic. In terms of recovery and wellness, it continues to be a priority in all care communities with the lens of recovery and wellness and all that we do, from our newsletters, our Color It Spirit, and our Color It Stories. And as it was pointed out earlier, demonstrating the importance of taking one's vacation so that you can refresh and recharge has been role modeled by our director, Jen. So it certainly has been a priority. And finally, looking to finance, Marcus is here and can provide a bit more specifics, but I can share that the reporting for the temporary retention incentive for our registered nursing staff, known as TRIN, has been completed. So, and now on to Renata for the other part of the director's report.
Thank you. Good morning. An update on our Fixing Long-Term Care Home Act and regulations. The Fixing Long-Term Care Home Act education sessions were presented both to resident and family councils in all 3 of our homes. The homes are also actively seeking resident and family participation in internal working groups, for example, Quality Improvement Committee and Emergency Management Planning Committee. All 3 homes meet the ministry requirement for cooling and through their current HVAC system. And on a daily basis, several times throughout the day, the temperature is monitored through the homes to ensure they are the temperature is in a comfortable range. Advantage Ontario invited Grey County Long-Term Care to present emergency management presentation to its membership on June the 29th. We provided an overview of the steps and actions that we are taking to implement the changes in emergency planning. Collaboratively, the Long-Term Care Committee surveyed the 19 long-term care homes in Grey and Bruce with the intent of identifying interest working groups. Working groups for Fixing Long-Term Care Home Act, IPAC Lead Collaborative, ALC Strategies, Human Health Resources, and Wellness and Recovery. Expertise from our 19 homes are invaluable to us and will provide support and resources across the long-term care homes. The Grey County homes have implemented the following changes. The updated Resident Bill of Rights has been posted, updated policies and procedures and education in the e-learning platform. Emergency management planning policies and procedures have been reviewed. The emergency plan is posted on the website. The quality improvement plans were submitted to Health Quality Ontario by June. The requirements, for example, contact information, reporting to the ministry and the ombudsman are up on the website. Our air conditioning system, as I said, meet our requirements. The nutrition managers and dietitians are currently updating the menu process. Listed here are the direct care hours for each of the homes as we work towards 4 hours per resident day, and the medical directors have been updated on their new requirements. Work continues with the partnership at both the regional and local levels. The Grey Bruce Long-Term Care Committee and healthcare partners are continuing to meet on a monthly basis. Collaborative work continues with the YMCA to promote the fully funded PSW program, and an overview session was held at Grey Gables for new students. The Research Institute for Aging recently held a virtual Walk with Me cultural change of aging in Canada session on May the 26th and 27th. During the session, the 2022 Trailblazers were recognized for making strides in changing the culture in long-term care. I'm pleased to share that the Grey County Long-Term Care Color It, Your Way Promise initiative was one of the 17 organizations across Canada to be recognized for this culture change. We continue to be thankful for the support of Council, the CAO, senior management, and the staff in all departments. We recognize that we are in it together as we color it for our residents, families, and the community. Are there any questions? Are there any questions? No? Okay.
I don't see any hands.
Okay. Thank you.
Sorry, Tara, I'm having a lot of technical difficulties. I'm just wondering if I should turn the chair over to another member of the committee this morning.
Unfortunately, our vice chair is away today, but we can do a quick election of a substitute chair if you wish to do that.
Well, I've been, my connection has been going in and out, and I'm only just picking up bits and pieces.
Okay. Sure. Perhaps if I could suggest, if Councillor Mackey would like to pass the chair off, just having a motion to appoint an acting chair for this meeting. Councillor Woodbury.
Yeah, I'd make a, excuse me, a motion to that Council Burley chair the meeting.
Okay, and is there a seconder? Warden Hicks. Thank you very much. All in favor? That is carried. Councillor Burley, are you able to take over the meeting as chair? Sorry, you're on mute, Mr. Burley.
Probably better if I was on mute, but yes, I will. Thank you.
Great, thank you so much.
So, Chair Mack, I'm not sure, did we ask if there's any questions from Renata or? No questions?
I believe, Mr. Chair, that's the point that we're at right now. Thank you.
Okay, is there any questions from the committee? Seeing none?
Sorry, there is a question from Councillor Clumpus.
Oh, sorry, Barb, go ahead, please.
Okay, thank you, Mr. Chair. Not a question, just congratulations on that amazing award for innovation and creativity. We're very, very proud of all of you and the work that has gone on to accomplish that. So that was my only comment. Well done. Congratulations.
Thank you for that, Barb. Madam CEO, did I see your hand up?
Yes, thank you, sir. So just thank you so much, Councillor Clumpus, for those kind words. And so just to advise the committee that it's our intention to, we'll put out a press release today, just acknowledging this for everyone. I think it is something that we really do want to celebrate for all of the staff. I don't think I can share my screen, but they did give us a lovely certificate of acknowledgement. And so that was really nice to get that. And I think it's a real honor. Canada's a big country. And so congratulations to everyone. Thanks.
Thank you, Madam CEO, and well presented. Madam Clerk, I'm not sure, do we have a recommendation on to receive this report for information? I believe it was moved and seconded.
It was correct.
Now, I understand I moved it, did I not? Is that appropriate or not?
I think that's fine for the purposes of this meeting.
Okay. So I guess a show of hands, all accepting the report. Opposed, the motion is carried. So changing my hat to chair, moving on with the agenda, we're down to our next report, LTCM 1222, long-term care operations. I need someone to move to put on the floor, please. Moved by Barb, second by John. And this report will be given by
Stacy and Shannon.
Okay, please go ahead.
So I think I'm to start the first part of the report. And then I'll pass it on. Okay, so thank you, Councillor Burley. In the report that starts under quality, you'll find the publicly reported indicators for Q4. While the data still acknowledges a greater level of resident acuity, it also reflects some areas of improvement. And one in particular, the taking antipsychotics without a diagnosis of psychosis and pain. And that's something we've been actively working to support. In addition to supporting these indicators, and as part of our county's comprehensive risk management program, we have scheduled operational reviews with each care community, beginning in 2022, going on to 2023, where Renata and I will visit each care community monthly to review an area of focus using the quality and risk management framework. Through that process, we're going to highlight strengths and acknowledge the wonderful work of our care communities, while also supporting consistency of practice for the 3 care communities and best practice, and then determine if any changes need to be made to system and processes from a quality improvement point of view. June, we focused on the resident experience. We look through clinical care and specifically the medication management systems. Now I'll refer to Renata for the next part of the quality report on our QUIP.
Thank you.
Please go ahead.
Thank you. Health Quality Ontario had requested that all healthcare sector or healthcare organizations submit a quality improvement plan on a voluntary basis for the year of 22-23. The Grey County Homes have submitted their QUIP by the June 30th deadline. The QUIPs had been placed on hold during the pandemic, and that was rescinded earlier this year. The priorities for 22-23 long-term care QUIP are number of ED visits for ambulatory care sensitive conditions. And those examples of those conditions are pneumonia, injurious falls, diabetes, and dehydration. The percentage of residents responding positively to what would you rate how well staff listened to you, the percentage of residents who responded positively to I can express my opinion without fear of consequences, and the number of residents who are prescribed an antipsychotic medication without a diagnosis of psychosis. The care communities are working at developing an internal target and improvement initiatives. That work was completed and the QUIPs were submitted by June the 30th. Attached are the quality improvement plans for each of the 3 care communities. They are also on the Grey County website. Are there any questions?
Thank you, Renata. Does the committee have any questions? Madam Clerk, I see no hands.
I do not see any hands either.
Okay, well, thank you, Renata.
So I'm going to pass it over to Stacy now.
Okay, Stacy, please go ahead.
Thank you. So I'll provide a few highlights in several sections of the report, and then we'll turn it over to Shannon, who will provide a summary of the remaining areas. So I'm going to start with the ministry inspections and the compliance. Ministry inspectors were on site in 2 of our care communities to conduct critical incident inspections and an infection prevention and control inspection, also known as an IPAC inspection. And I'm very pleased to report that after a comprehensive review involving observations, interviews, record reviews, and inspection protocols, that Lee Manor had no areas of non-compliance. And in the case of Rockwood Terrace, they have yet to receive their final report, but it is expected to be available for our next meeting. In terms of outbreaks, both Grey Gables and Lee Manor experienced outbreaks during the reporting period. Grey Gables was a confirmed rhinovirus, which is also known as the common cold. And they did a great job of containing that and resolving it very quickly. And as Dana indicated in the director's report, Lee Manor also experienced COVID outbreaks in 3 different home areas. One was declared in April, which was also resolved in April, and 2 occurred in May, which were resolved early on in June. And also, as mentioned, in all outbreaks, our care communities work very closely with our partners at Public Health to manage and monitor each situation through daily team meetings. And they also come on site to do an IPAC assessment to support our practices and offer any recommendations. And we're very grateful for that team approach and ongoing collaboration. In terms of people, overall, I think healthcare is experiencing some human resources challenges, and our care communities are working very closely with our HR support team to recruit and onboard new staff and explore new ideas and recruitment strategies, and we'll continue to collaborate moving forward as we anticipate ongoing challenges. In terms of location and events and projects that have been happening in the care communities, I think each home continues to offer meaningful and engaging opportunities for residents to live life and experience joy, whether it's in the form of daily structured activities or just even daily interactions. And we're all committed to coloring it for our residents. I would like to highlight one program that was very well received here at Lee Manor. And in recognition of Seniors Month, which was in June, our recreation team wanted to do something really special to highlight our residents. And they came up with a project called These Hands. And residents were asked to share what their hands have accomplished throughout their lifetime, and their stories were paired with portraits of their hands. These were put on display in our ice cream parlor for staff to see, visitors to see. And it really was, the reaction was very powerful. We learned something new about our residents, and even more special, some of our families engaged in the project as well and spoke on behalf of their loved one who maybe couldn't share their stories anymore. So it was a very impactful project that was far reaching than what we originally anticipated, but certainly a good example of how we color it for our residents and always thinking outside of the box. So with that, Shannon, unless there are any questions, I can turn it over to Shannon.
If there's no questions, Shannon, please go ahead.
Oh, perfect. Thank you. Thank you, Stacy, and thank you, Mr. Chair. And through you, Mr. Chair. The occupancy report shows that we are slightly under the 97% mark that we need to meet by September. The homes are continuing to move residents in as the rooms become available. Grey Gables is trending lower, and that is because of the BSTU unit. We continue to move our traditional residents into Pioneer Valley as the beds become available, and we continue to fill the beds in the BSTU, or what we're calling Maple Lane, as we can. We have an agreement with the ministry and with our partners that we will not admit behavior residents in with one of our traditional residents. So unfortunately, that sometimes leaves beds unavailable until we can get those residents moved. The other barriers have been the outbreaks, where we've had respiratory and COVID, when the admissions are stopped as well. Under our health system and partners, Lee Manor had a public health rep conduct 2 IPAC assessments during the reporting period to monitor and manage the outbreaks. Rockwood Terrace had public health in to complete an inspection of the kitchen, of the main kitchen, and the 2 violations noted have been corrected. Under written complaints, each of the home areas have already had some complaints, and they have all been addressed by the care teams. We continue to work with everyone to find resolutions to some of those issues. We continue to have resident council and family council meetings to give everyone the opportunity to have a say in the running of the homes and to listen to their concerns and compliments. This reporting period, the new Residents' Bill of Rights was reviewed, and Renata has also attended family council meetings to give an overview of the Fixing Long-Term Care Act. To highlight a color story at Grey Gables, Grey Gables was asked by the Grey Highlands Peace Committee to celebrate the Queen's Jubilee, their 75-year Jubilee. We were also asked that if we would be able to plant a tree for them in the front yard. So on June 4th, the community of Markdale and the Grey Gables residents participated in a celebration that included ribbon cutting, speeches, and a presentation of a plaque for the lobby at Grey Gables. It was so nice to see the residents participating in sharing stories that they had of the Queen, and it was a very beautiful day all around. And that concludes the operational report. If anybody has any questions.
Thank you, Shannon. Does the committee have any questions on the report? Seeing none, well presented. So I'll ask for a show of hands, all in favor of receiving the report for information. Opposed of the report is received. Thank you. So moving on for agenda, we are down to long-term care financial update. The recommendation is the report LTCRCM 1322 regarding long-term care financial update in the year in production as of April 30th, 2022 received for information. Someone to move, put on the floor, please. Moved by Barb, second by John. And I guess I'm going to turn this over to Mary Lou? Or Marcus? Who?
I think Marcus will be
Marcus.
presenting this report.
If I could just introduce Marcus.
Sure.
Thanks. Marcus has been with us. It'll be a year in August. He just recently moved into a new role. So he's the manager of finance for long-term care. And he has one analyst who you meet probably at some point, Steve Leary, working with him. So Marcus and Steve have done a lot of work putting together this in conjunction with speaking with the executive directors, and he'll be presenting the report.
Thank you, Mary Lou. Marcus, please go ahead. Welcome.
Thank you. Thank you, Mr. Chair. Yes, we have it for you as the long-term care financial projection and forecast. So this report provides a projection for the long-term care based on revenue expenditures as of April 30th, 2022. The reason that we did April 30th was to ensure that we have the most accurate picture with our invoices and financial expenditures coming in along with ministry revenue, just to make sure that what we are forecasting, we're not missing any glaring things that would otherwise skew the projection. Within this, we have made adjustments to incorporate each of the projections as this is an early year projection. These numbers have a number of variables and assumptions within them that'll adjust as the year progresses. We are looking from April for the full year, so there's still plenty of the year to go to change it one way or another. Some of these examples might be staffing shortages, shifts paid at overtime or agency rates, modified duty of staff, unanticipated repairs, infectious disease outbreaks, the impacts of the CMI index or the case mix index. So all these ones are just a few that have been listed as that they could drastically change it one way or another, but this is based off what we have. At this point in the year, we are in a financial position that remains as an overall surplus of $328,800, which would result in at the end of the year. This is comprised of $156,800 for Grey Gables, $117,900 for Lee Manor, and $54,100 for Rockwood Terrace. Should this surplus be achieved at the end of the year and that we remain on this path, we will be reducing the operating budget transfer from reserve, which is currently being utilized to ensure that we didn't have as large of a levy increase. So that would reduce the amount that we would, and anything further would then get applied back to it. That represents a 0.9% variance from our 2022 budget, which has a gross expenditures of $36,333,500. This current position shows savings primarily from wages and associated benefits due to the staffing shortages and HR problems that was previously mentioned. However, it is again a very early forecast, as we like to note again. We are monitoring program costs and eligible expenditures and guidelines for the maximum funding allocations that we receive from the ministry and any savings in the ministry programs. So with this one, kind of going down to the budget impacts and assumptions with this one, in here we've listed off quite a few of the assumptions that we've made to make these projections as they sit. So just going through some of them, salaries and benefits is 85% of our entire expenditures at this point. So saying that if we have anything to switch within increased staffing, decreased staffing, you can see that that makes the largest swing of the projection. So that's why we continue to say that there is something that we need to highly note to say that things could change, especially when it comes to the backfill of vacation, illness, training, modified duty for people coming back from injury and everything like that. Those sort of things can swing us. We did include an accrual for vacation within ours for the approved vacation time off. That's all the way up till August due to the schedule releases. However, the one things we don't know is that if those backfill of those positions, would they be covered by regular paid time employees, or will we have to use overtime or agency rate? If we have to use either of those two, it swings the projections even greater. And that's one that we wanted to highlight. The case mix index has not been released for this year yet. We expect it to be released for August, retroactive to April, similar as last year. The largest swing that it could potentially do is a 5% decrease on that, which would, if similar to last year, would result in about $137,600 reduction in overall funding. That being said, we don't know where we are going to be sitting with that one, because as we've mentioned before, just for a refresher for the committee, the case mix index is a general pie that is given out to all the homes, and based on where you sit on the scale of your case mix index is the allotment that you receive. So even though we might have a higher acuity patient residents, and we may be recording it well, it could very well be that other homes in other areas of the province are showing higher, so they would receive more, and we would be put further down the list. That one we have to wait and see kind of where it shakes out in August. But on the worst case scenario, we would see a 5% reduction, or the 137,000. Or we could see an increase. It's something that we're just waiting to see, and we will do the calculations as soon as it's available. The budget was also developed with an assumption of 1.5% global level of care, which we have received, and that remains in the budget amount. The ministry also increased our nursing and personal care program support services and raw food funding envelopes, which have been received in June and were retroactive to April, and those are being added in for projections on the ongoing basis. The impacts of these increases is still being reviewed, just so that we can see exactly how we comparison to budget, which we'll have ready at the next financial update. The impact of inflation and supply chain is no urgent news for you to all know. You all are well aware of what's going on with that, and that continues to cause issues not only on staffing, recruitment, and retention, as well as the ability for us to source contractors for our projects, and just even general supplies for the other expenditures within the homes. Going into some of the areas here, long-term care administration. This is the area that houses the expenses of the director of long-term care, accreditation and quality specialist, clinical specialist, support services, and education coordinator. This department is reallocated out to the three homes on a per bed basis. That amount is applied to them because when we are submitting to the ministry, they are asking for it on the home level. So this is our admin that's just reallocated evenly across the three homes. Grey Gables, going into theirs, is trending less than budget and is attributed again to the vacancy and shifts in both nursing and support positions. That's not to say that they aren't doing their absolute best and that everyone is to make sure that they fill these positions. Unfortunately, just with the limited amount of people out there in the market and with the high demand, we are constantly fighting to fill these shifts and making sure that we have the best care provided for the residents. There is overages within Grey Gables within the RN and RPN departments. However, that is expected and planned as we have the ministry funding for the increased direct care hours, which was noted before that we are advancing towards the 4 hours of direct care, and the subsequent funding has been provided with that. So we are moving those overages as the claimable expenses to that funding. PSW remains under budget as an area that you'll see across the 3 homes as an area that is a struggle to find more and more PSWs to fill these lines. Grey Gables, unfortunately, had their longtime maintenance manager recently retire and with the change of that and the issues of procuring contractors for both medium and large projects. Quite a few capital projects are being delayed, and we are still pursuing them as quickly as we possibly can, but we still run into the issue of not only our experience leaving us for where we're tracking and having to recruit a new one, but also just getting contractors to actually commit to these kind of larger projects. Those projects have, with their funds, have been earmarked and will be transferred to reserve for future use. Lee Manor is expected to end the year on target, as mentioned before. Materials and purchase services are overall are expected to end on budget. Support roles remain on budget with position vacancies and delays in recruitment, again due to labor shortages. Lee Manor's capital budget is anticipated to end on target. They selected projects to ensure they were completed, and they didn't have as many major projects that would require multiple contractors to complete. Rockwood Terrace is expected to end the year within budget as well. Savings currently exist within the staffing, support, and program service roles. As you can now see, that's a trend across all 3 homes. Support roles within these vacancies is again due to the shortage. There is a revenue shortfall within them within the preferred private and semi-private. If the trends continue at their current rate, we will see a shortfall of about $21,900 in their private and semi-preferred rates. Rockwood's capital budget is going to be on target. Again, as the committee is well aware, with Rockwood's redevelopment, they are doing projects to make sure that the environment is still both safe, comfortable, while balancing the need to not add something that has a 10-year life that we would be able to bring with us to the new build, as they are expected to move within 4 years for those who are on the redevelopment committee. Long-term care redevelopment, as just a segue to that, they've amounted expenses of $398,836 in the first 4 months, and that is expenses related to the ongoing work done by consultants and architects in that. With COVID has the COVID-19 expenditures and how that is impacting with the homes. They are currently filing and reporting their expenditures to the ministry for reimbursement. That is for anything that's an increased spending related to additional staff, personal protective equipment, cleaning supplies, equipment to support infection prevention and control measures, and screening and testing initiatives. So far, as of to date, Grey Gables has received $330,662. Lee Manor has received $490,667. Rockwood Terrace received $224,598 for a total amount of $1,046,127. The funding and expense filing is slated to continue until March of 2023 at the end of their fiscal year. And we don't know yet of any further changes to that, but we're still a ways out for the ministry to make any more announcements in that. Again, it'll mostly depend on where we're sitting come near that time. Long-term care staff, again, with cost containment measures, work closely with finance, human HR, as well as purchasing to ensure responsible spending, as well as reviewing it. We continue to work closely with them to ensure that they have all the financial data available for them to make the best decision, both for the well-being of the residents, but also to be financially responsible as well. And then we have the financial and resource implication, which we've noted again, the surplus of which is about a 0.9% variance, which again is going towards our reserve transfer if we remain on budget. The main thing, again, just to highlight again, is that the homes are doing their absolute best, and we have included this time around quite a numerous amount of assumptions and accruals in there to try and give the best picture. But with it still being from April's timeline, we still have majority of the year to go. And with the summer coming in, as much as we've tried to account for it, things can change. But we are providing them monthly financial updates as well as projection updates on a month-by-month basis, so we can catch and we have more early warning detection systems in place. And I'd be happy to take any questions.
Thank you, Marcus, for a great report. Does the committee have any comments or questions? Tara, I do not see anybody on my screen, so I.
Sorry, Warden. Sorry, go ahead.
Yes.
Warden Hicks does have a question or comment.
Please go ahead, Mr. Warden.
Thank you, Mr. Chair. I wonder if someone could give more detail about what specific projects at Grey Gables are at risk of not being completed.
And who's going to take that?
Shannon, did you want to?
Sure, I can. I'm just going to pull up my list of capital projects.
If I may, Mr. Chair, while Shannon gets her work in front of her, I can advise this committee that we are having issues across the county with capital procurement, especially as the year goes along, putting tenders and RFPs out and not getting bids. Like, just people aren't looking for additional work at this time. So certainly that may be a contributing factor here. And I am also aware of a number of situations where we did receive bids, but they were really significantly outside the scope of the budget that was available. And, you know, then we kind of take a step back and determine whether or not it's critical that the project move forward at this time. If it's not critical, then our usual practice is to take a step back and say, we'll look at this again next year if we have reason to believe that what we're seeing in the bid is really an anomaly, and can expect that things will maybe, you know, the costs will come down a little bit next year. But have you got what you need, Shannon?
Yes, I do. So the dry sprinkler system, we have been trying to get some quotes and people in, but when I talked to Georgian Bay Fire and Safety, they said that they're having a really hard time even getting contractors to work. So that one might be, we're still going to try and work on it, but that one might be one that we have to postpone. And the other one is the retaining wall as well. So we're still working on it, and hopefully we're trying to get some blueprints done up as well, but then get some drawings done. So those are the two main ones. The rest of them we're still working on, and hopefully we'll have them completed by the end.
Thank you, Shannon. Mr. Warden, did that answer your question?
It does, yes. Thank you.
Okay. I see no other questions, Madam Clerk, and I apologize because my screen maybe it's not quite as good as could be. But if I see no questions, I'll ask for a vote on accepting the report. Show of hands, please. It's carried. Thank you. So I'll move on for our agenda. We're down to our next meeting date. And Madam Clerk, I see you sent an email out concerning a tour. I wonder, did you want to comment on that?
Sure. The EDs of the homes in long-term care have organized a tour for the Committee of Management as well as the Long-Term Care Redevelopment Task Force on August 30th. So the plan right now is that those committees will tour the long-term care homes, as well as the Rockwood Terrace site as a part of this tour. So that will be happening on August the 30th.
Thank you, Madam Clerk. That should be a great tour. Mr. Chair, do you want me to turn the floor over to you? Any comments?
Thanks, Chair Burley. Thanks very much for stepping in. I don't know what's going on with my internet this morning, but it's been intermittent to say the best. I did speak to Jennifer, I believe it was on Friday, and in regards to the tour, we want to make sure that there's not going to be any impact to our residents. So depending on where the variant goes over the next few weeks, that will be the determination whether we actually tour the homes. But certainly a tour of the Rockwood site will happen that day. And I just wanted to, I tried to mention earlier on in regards to the recognition from the Research Institute on Aging, and you know, hats off to the entire team for the recognition for a Canada-wide, you know, 1 out of 17. You know, that's pretty amazing. So just thanks to all the staff for their continued hard work for our long-term care residents, and I hope everyone has a good summer. Thank you.
Thank you, Mr. Chair. If we've no other business here today, I guess I'll ask for a motion to adjourn, please. Moved by Scott, second by Mr. Warden. We adjourn. Show of hands, all in favor? It's carried. Thank you, everybody.
Thank you.